And now to our GMA cover story. The number of measles cases climbing to over 460 patients nationwide. 5 more patients confirmed in Michigan, bringing the state total to 39. And at least 3 of those patients were vaccinated. Dr. Jennifer Ashton is here with what you need to know. So what do we need to know about this?
Robin, measles is really dominating the medical and health headlines, and for good reason. This is the single most infectious virus in the world. About 90% of people who are exposed to it, if they have not been vaccinated, will become infected and sick. Now let's talk about the vaccine, though. It is incredibly safe and effective. It's about 97% effective after you get the 2 doses, about 93% after just a single dose, and you are considered protected lifelong. But it is not perfect. You saw that number was 97, not 100. So there is a small percentage of people that we call non-responders, and that's what appears to be going on in these very, very rare cases of people becoming sick after they know they've been vaccinated.
Now, you've heard these stories. There's some stories circulating that the vaccine wears off, that you may need a booster. Is any of that?
No. And Robin, that's really the most important thing about this. We are seeing with this national outbreak so much myth, misinformation, miseducation. It is making people sick. So again, the CDC is all over this. They are saying to people, again, this vaccine does not wear off. You don't need a booster. But there's also talk about, should I get tested? Should I get this blood test to see if I'm protected? The answer is no. Number one, that test was really designed to see if you've been naturally exposed. So that's different than vaccine protection. And it's expensive. And, you know, for the rare people who might get that test result back and it shows no immunity, they're going to be left with saying, well, what do I do? Really, this really just pertains to medical professionals, healthcare providers who need to make sure that they're protected. The key year, Robin, 1957. If you were born before that, you are presumed to have been naturally exposed. If you were born after that, the vast majority of people were protected
so the timing
with
of when
vaccine.
You were born.
Yep.
Okay, you know what? We haven't had to really deal with this in a very, very long time. Remind people of the severity, especially with children.
Yeah, let's take a history and medical walk down memory lane and realize that this is not just a possibility. We can see this. So take a look at these numbers, Robin, of children who are infected with measles. 1 in 10 will develop an ear infection that could lead to deafness. 1 in 20 will develop pneumonia that could require ICU support. 1 in 1,000 will develop brain swelling, which we call encephalitis, which could be deadly. And 1 to 2 out of 1,000 children will die of measles. Global perspective here, you don't have to go far back in the history books. 2017, over 100,000 people worldwide died of measles. We take this seriously.
All right. Thank you, Jen, very much. And I'm going to see you a little bit later. We're going to do a podcast.
Can't wait.
You got your new podcast that's launching,
Coming out. That's right. We'll be talking about it more.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.